Okay, so good afternoon, everybody. I'd like to welcome you all to November's governing body in public, both our regular governing body members and those members of the public who will be watching our meeting on YouTube. Since we last met, coronavirus situation in Sheffield has changed and continues to change significantly. A few weeks ago, we found ourselves moving into Tier 3 restrictions, and as of today, we find ourselves in the position of a national lockdown. However, one thing that has remained a priority for us at Sheffield CCG has been ensuring that the people of Sheffield have fair access to high quality, effective and safe services. And although we have been working in providing an emergency response to the coronavirus pandemic, our teams have also been really busy in working on our commissioning intentions. Those are our priorities and our plans to meet the needs of the Sheffield population. And in today's meeting, we will be hearing about those plans and how they join up with the plans of our partners working in the council, in hospitals, mental health services, social care and GP surgeries. So before I move on to the main agenda, I'd just like to highlight one point, and that is to highlight and thank our colleagues in GP surgeries across Sheffield, who throughout the pandemic have rapidly adapted their ways of working to ensure that people in Sheffield are still able to access their GPs when they're unwell, to have their long-term conditions looked after, and for important things such as their flu vaccinations. As we head into this second wave of COVID and our second lockdown, I would just like to remind members of the public that your GP is still available. And if you are suffering with signs or symptoms of serious illness that you're concerned about, then you can and you should speak with your GP or 111. And although you might not be able to directly book a face-to-face appointment at your surgery, please be assured that the healthcare team will speak to you by telephone, work with you to understand what the problem is and provide any necessary treatment, be that over the telephone, by video consultation or by asking you to attend surgery in person. So please be kind to the staff in your GP surgery. They're working harder now than ever and are facing an unprecedented set of challenges, but they're doing this to keep them and you safe through this. So I'll move us now on to the main agenda. If you just bear with me 1 second while I bring that document up onto my screen, which is our declarations of interest. So do any members of our governing body this afternoon have any declarations of interest in any of the items on the agenda that they wish to bring up now? Okay, thank you. We'll now move on to questions from members of the public. So I'm going to hand over to Jackie Mills just to confirm whether we've had any questions for this month's meeting.
No, I've not had notification that we've received any questions.
Okay, thank you, Jackie. So I'll move us on to item 5 now of the agenda, which is approval of the previous minutes from the governing body meeting held in public on the 3rd of September. So I'll take these by groups of pages. So if there are any inaccuracies or any items that members of governing body wish to bring up, please do so as we go through. So any inaccuracies or changes needed to pages 1 and 2, 3 and 4.
I have one, Chair, for page 4.
Thank you.
Section E on the 3rd line highlighted unless it was an urgent request, I think should read for urgent requests.
Okay, thank you, Alan. Carol, can you note that and amend that point in the minutes for us? Moving on to pages 5 and 6, 7 and 8, 9 and 10, 11 and 12.
Terry, at the top of page 11, there's an acronym, an abbreviation used for CI, small s, that I'm not sure that it's explained previously in the point. I presume it means commissioning intentions, but we might, for the sake of clarity, but just maybe want to make that explicit.
Okay, thank you, Andrew. I think that's a really good point. So 2 points there. Firstly, can we clarify that it means commissioning intentions? And if it does, Carol, could you expand that so that commissioning intentions is stated there, and then the abbreviation put afterwards in parentheses so that we've got reference to that for the rest of the document. Okay. So any further amendments on pages 11 or 12? 13 and 14, 15 and 16, 17, and finally page 18.
I have two for page 17, Chair. The top of page 17 repeats the words "getting some" twice in the same sentence. I think we just need to delete one of those. And then under section E, the Learning Disabilities Mortality Review, on the first sentence, it's the word "now," I think needs removing because it indicates it's new and it isn't "we always have been." So I think if we just remove that word "now," it'll just clarify that section.
Okay, thank you, Alan. Any further amendments on 17 or 18? Okay, thank you. So David Warwicker, do you want to come in?
Oh, just to go back to Andrew's amendment. The commissioning intentions abbreviation is defined about 2/3 of the way down page 8, no, 3/4 of the way down page 8. So it is in the same item of 119/20. The abbreviation is defined earlier on, just much earlier on.
Okay, thank you, David. I'm just wondering, given the that clarity is there, but sort of members of governing body are highlighting that it isn't clear. I just wonder, Carol, if you could just put a glossary at the head of the minutes just to explain that the abbreviation CI throughout the document refers to commissioning intentions, just so that we've got that as clarity. Thank you, David, for your eagle eyes on that part of the minutes. Thank you. Okay, I'll move us now on to the next item, which is matters arising, and I will take these one by one. So the first matter arising is 122/19, and that was in relation to a question from the public. Brian, could you give us an update on where we are with that item, please?
Yeah, so the ACP workforce group is not as active as it was before the advent of COVID. So that work, they are aware of it, but it is not active at the minute, but we will keep the action outstanding and underway. Thank
you, Brian. On to item 13/20, around facilitating a request from intelligence from practices. That item has been recommended for closure. Moving on to item 36/20, which is the commissioning plan, operational plan and commissioning intentions. That appears on today's agenda, so we will be addressing that. Item 78/20J, feedback from lay members around their contact with the chair from Healthwatch Sheffield, specifically looking at the Inequalities task and finish group. That has been recommended for closure. Item 84/20, concerns raised for our safeguarding assurance report. That item has now been recommended for closure. 97/20, standards of business conduct. All voting members of governing body have been emailed the documents for them to sign. That has been recommended for closure. So Jackie, can you confirm that all members of governing body have signed and returned their documents?
I think we were just chasing one this morning. I don't know if we've managed to get that last person. Kath?
We have, we're 100% now.
Excellent.
Thank you for that confirmation. Item 99/20, which is relating to a sponsorship proposal. Conversations are still ongoing offline regarding that item, and we will bring that back to governing body in due course. Item 100/20, which is communications around swab testings being made available to the voluntary sector. We were hoping to have an update on that for governing body today. Lucy Ettridge, our Deputy Director of Communications, is unable to join us today, but I'm wondering if either Brian in your role as our Deputy AO or Erin in our communications team could give us any further update on that or inform us whether that needs postponing.
Can I suggest we postpone that, Terry, until Lucy returns? Thank you.
Okay, thank you. Item 300/20 around a financial masterclass for governing body members. That item remains open. Do we have any update on that, Jackie?
My suggestion is that we pick it up under our private agenda when we've got an item on development sessions for the governing body.
Okay, fantastic. Thank you. Reflections from the last meeting. There were some thoughts and comments in the August governing body meeting that we were hoping to take into the development session. Some of those were taken into our development session in October, and we have a substantive item in private later around planning how we use governing body, public, private and development sessions moving forward. So I'm going to recommend that that item is closed from today. Item 11620, approval of unadopted minutes there. And this was again in specific relation to the sponsorship proposals. I can confirm that I've met with Charlotte McMurray from the Medicines Optimisation team to discuss and look at some NHS England guidance around working with pharmaceutical industry. Charlotte's working very hard on trying to translate and decipher what that might mean for us as a CCG, and we'll bring that back to a future development session. Item 11820, patient story, has been closed. Item 119/20, with regards to phase 3 planning, all items there have been closed. Item 120/20, our month 4 finance report, all items there have been closed. Item 121/20, again, all items there have been closed. And then the final item on matters arising is 122/20, patient safety, quality and experience report. We were hoping to have an update in governing body on the appointment of the CCG's new patient safety expert. We have got some update information in the table there, but I'm just wondering for clarity, Alan, whether you could just give us a very brief verbal update on where we are with that.
Yes, just 2 points of clarity, and it might have been my wording. The title is patient, not a patient safety expert. It's a patient safety specialist. And we have looked internally and worked with one of our current members of staff, fitting into their current role, chair. And doing a blended approach, which has been accepted by NHS England and Improvement, that will be utilising additional quality review managers within the CCG as well to roll out what this post will be. So therefore, I do feel it's closed, and we have that workforce in place already, and we have informed NHS England and Improvement.
Okay, thank you, Alan. So just running through the matters arising table, does anybody have anything else that they wish to bring up as we run through those? Brian?
Sorry, I blinked, so I missed it. Could I just take us right back to the very start on 1320, where there were a number of items that were recommended for closure, but the first one, which was around YAS, if I could ask that item remains open. And the update would be that discussions are ongoing in relation to the appropriateness of YAS 111 bookings into primary care. And sleight of hand, can I ask for that action to move forward to the Director of Commission and Development, and we'll provide an update in January.
Okay, thank you, Brian. Sandy, I presume you are happy to pick that action up. Thank you. Okay. So I will now move us on to our regular fixture in governing body. that is really often very helpful in focusing on why we're all here and why we do what we do, and that's our patient story. So I am just going to bring up patient story. So if we could just hold one moment, I will get the screen shared. And if someone would just be kind enough to show me a thumb to let me know that they can see the video. Okay.
I think the volume's quite low.
Okay. I will reshare that again and see if I can make the volume louder for you.
I'm 17 years old when I was 6. I'm one of 5 children, including one little sister of age 3. I also had a younger brother who had cerebral palsy, but sadly he died 3 years ago when he was 6 years old because he got a lung infection. I care for my older sister who has chronic epilepsy, learning disabilities, and tuberous sclerosis. I have to help her in daily life in lots of ways, including helping her when she has seizures and reminding her to eat and take her medication. When my sister has seizures, it's very frightening and distressing. And during this pandemic, we've had to be especially careful, as 2 of my family members are at a huge risk from the virus. So we have been shielding despite the recent easing on lockdown regulations. We do have a carer helping our family sometimes, but because of COVID-19, the carers have lessened and we've had to keep a distance in our own home, which is quite weird. It's also something that is quite hard to be comfortable with when anybody could have the virus. My older brother was away at university, so a lot used to fall on to me, especially looking after my younger siblings when my parents were away at medical appointments. Because of the lockdown, he has come home, though and has been trying to study at home. My dad has some health problems and has also been working full-time at home during lockdown. And I have just finished lower sixth form and I'm currently in the process of applying to medicine at university. So our house has been very busy and it can be hard to study. Before the lockdown, I could go to school and take my mind off everything. But when with my sister being at high risk with COVID-19, we've had to be especially careful about going out of the house, which has put me under mental strain. I always have in my mind that something could go wrong. It has made me on edge all the time. I've lost 8 family members in Pakistan to COVID-19, which has been really hard for all of us. Hi.
Thank you, Chair. It might be worth me just adding a little bit of context to that young carer's story. Again, I want to thank the individual for being able to share that story with us with regards to how herself as a young carer is attempting to cope through this pandemic, given the wider caring responsibilities that she has for her family, but also in an attempt to obviously progress with her education is pretty vital for us as a governing body to recognise that that there is an untold story of COVID or non-COVID where young carers play a significant part of caring for individuals in the community. And particularly the resources around to support those young carers are vital because they provide the wider support, as do adult carers. An interesting fact while I was researching some of the backfill to this story is that, and again, I haven't checked the validity of this claim, but there is more registered young carers in the UK than they are registered nurses. So you know, that's quite a stark fact, really, for us to think about when we're looking at resources of caring, both in the community and hospitals, and that is the registered carers. That is not
Hi, thanks for that video, sound video. That was really brought it home. Just to remind colleagues, there is a specialist organisation in the city that supports young carers, Sheffield Young Carers, and they do fantastic work with young carers of all ages up until adulthood. It's a voluntary organisation based in the city. So if any of us come across young carers, that can be a good organisation to point people to. I've got the contact details if we want to add it to this video, but their phone number is 0114 258 4595. Thank you.
Thank you, Mandy. Does anybody else have any other comments or reflections before we move on? Mark, please.
Yeah, I think the thing that the video reminds me of, and we're involved in discussions in the Joint Commissioning Committee with the Council about how we can take a more systematic approach to supporting the voluntary and community sector in the city. And that story, I think, just is an affirmation and reminds us that as the two big statutory commissioners in the city, we, pursuing that course of action with the council, which was just started discussing it now, is, it affirms its importance.
Thank you, Mark. Okay, so I'm now going to move us on to the substantive items on this afternoon's agenda. Before I do that, I would just like to note apologies from Lee Sorsby and also from Judy Robinson from Health Watch, and to welcome Trish Edney to today's governing body meeting. Trish is no stranger to governing body, having been with us in the past, but welcome this afternoon, Patricia.
Thank you.
Okay, right, so on to item 8 on our agenda, which is the proposed schedule of governing body meetings. I'll hand over to Kath Tilney.
Thank you, Chair. So this is basically inviting governing body to approve the schedule of meetings. The dates that are proposed are using the same approach as has been in previous years, including the public, the private, and the development sessions. We will clearly be continuing to hold them virtually until we're able to come back to 722, and when that point comes, we'll have to review and decide what we do at that point, but for now the assumption is that they will be held virtually. So it's really just asking if people are happy to approve the proposed schedule.
Okay, thank you, Kath. So two questions here. The first one is to approve the proposed dates of governing body meetings to be held in public. The importance of that is twofold. Firstly, so that members of the public are aware of when we're meeting and they can plan to be engaged with those meetings. And secondly, so we can schedule our own diaries. And the second item that we need to approve there is whether we are happy with the proposed dates for our strategic development sessions. So I will take this item as approved unless anybody wishes to dissent now. Okay, thank you, Kath. We're approving the schedule for governing body, and we will be able to get that up onto the CCG website in due course so that members of the public are aware of our public business. Okay, item number 9 So this is our NHS Sheffield CCG operational plans and our commissioning intentions, which I alluded to in my opening remarks for governing body this afternoon. So I'm going to hand over to our Director of Commissioning Development, Sandy, to give us an overview of what this is.
Thank you, Chair. So I'd like to present to governing body the revised operational plan for 2021. As we all know, this was initially presented in February and March this year, but due to the COVID pandemic, we wanted to make sure that not only the priorities of the CCG continued to be fit for purpose, but also included the areas that we now need to prioritise due to COVID. So the plan presented today details the journey that we've been on to ensure all of our priorities are correct, but also takes into consideration the need for a more flexible approach that changes and adapts to the ever-changing landscape that we're finding ourselves in. So even since this paper was written, things have changed, as Terry spoke about earlier. So we're now in a national lockdown and into wave 2 of the COVID pandemic. The plan still identifies what we want to do and deliver for the remaining of 2021, but does bear in mind any changes that may come across from us. The plan still, apologies. So therefore, it details the requirements of the phase 3 letter. It does detail our commissioning intentions, and we continue to work with our colleagues across Sheffield in driving forward what is needed for there to be put in place for the Sheffield population, as well as supporting both primary and secondary care during the second wave, and also how we want to continue to support our staff. The plan details, again, what we want to do, but very much identifies the need for us to be able to adapt and flex what we want to deliver with the COVID pandemic as it goes forward. So I won't go through the plan page by page, but just to highlight a few points. The CCG's vision remains the same, so working with you to make Sheffield healthier. We have worked with our partners to understand the challenges that we face as a city, and these are detailed within the plan. We've also developed a number of principles which guide our work and help us to make sure our work is true to our vision and values of the CCG and also fulfills our purpose. During the last few months, all organisations across the ACP, the Accountable Care Partnership, have been working closely together during this pandemic and have developed a number of priorities that will play a key role for our system work. And these are detailed within the plan as 7 near-term priorities. We've also worked with our local authority colleagues on developing some aligned commissioning priorities, and all of these have been pulled into the development of our CCG commissioning intentions. We've also detailed within the plan our response to COVID, so what we've done in terms of engaging with our population, identifying what it is that we wanted to do to tackle the health inequalities that was in the system, as well as what has happened during the COVID pandemic. We've also, part of the plan, obviously as part of that, is our commissioning intentions, and how these are presented is that we've aligned these to the challenges that we've worked up, as well as identify any examples of the benefits and the outputs that will emerge from delivering these intentions. So we've also talked about how we are supporting our staff, and like I said, the plan itself, it is what we want to deliver. We've gone through a very rigorous process and taken governing body on the journey of that process, but obviously very much bearing in mind that things do change and have changed and will continue to change, and very much supporting our colleagues as well as our staff through those changes. So following any comments or questions, I'm asking governing body to approve the plan at this point in time, but also recognising that things may change with the current position of the NHS.
Thank you, Sandy. So I'll open up to questions and comments, please. So Chris Neild. Chris, could we ask you to unmute, please?
Oh, sorry. Thank you for this report, and I know the work that's gone on, really, because of the learning from COVID and the different emphasis on some of the challenges. What I'm really particularly pleased about the learning from COVID, which has strengthened our resolve with regard to the health inequalities and looking at the greatest need, and with particular take note of some of the ways of working and what we still need to do because of the learning from COVID, and particularly that link with communities and with the voluntary sector, which I think is particularly important. And I think the whole report just reflects on the work that's taken place in a pandemic, but also that forward view about how we can manage this and what else we need to change in our existing structure. So thanks for that.
Thank you, Chris.
Thank you, Chris. Mandy Forrest, please.
Thanks for this report, Sandy. It's really helpful. Can I just ask though, under the section Restoring Services and Building Resilience to do with dementia, the mental health team are producing 7 bite-sized training films on different topics to help professionals, which is brilliant and great. But how relevant will they be to unpaid carers? Because I think one of the things we have learned from COVID is a lot of the caring for people who are vulnerable, particularly people with learning disabilities, has been maintained by family carers. And I know with my carers centre hat on, it's been very challenging for carers for people with dementia. So I just wondered whether those films, those training films, could be of use to carers. And if we're not sure, how are we going to support carers to carry on caring? Because the situation isn't going to, it's going to take a while to get back to any kind of normal. And therefore it will still fall to carers. Thank you.
I think that's a really good suggestion. Thank you. And what I'll do is I'll take that back to the team to see if the films can be aligned and connected with the carers, and if not, what we can do with the work that we are doing with the carers as well. So I will take that suggestion back. Thank you.
Okay, thank you. And we'll put that down as a matters arising for future meetings. John McElwraith, please.
Yes, thank you, Chair. I just wanted to thank Sandy and colleagues for the report, and just to feed into the meeting. Certainly, the reflections over the last year, that the ever-increasing alignment of the conversations between colleagues in the council and across the CCG, and you can see that in this document. And hopefully, as we progress beyond COVID, we'll see that realisation of real, genuine impact for our communities, especially addressing some of those health inequalities that I referred to. And then the other thing I would want to add is I've been in a number of arenas over the last 2 weeks with voluntary and community sector and BAME organisations, and increasingly they're asking us to reach out to them, to work in a more enhanced way with them, to support them to work with their communities. And it's about building that capital, that social capital, if you like, across the communities, rather than just the perception of we just need to do to. It's remembering to work with. Thank you, Chair.
Thank you, John. Mark Gamsu, please.
Yeah, thanks, Chair. Again, I have to say, I think this reads quite differently to some of the commissioning intentions papers that we've seen in previous years. It does feel much more grounded and sort of relevant to geared towards Sheffield and the Sheffield structures than I've seen before. So that feels like a really, it is, I think, a really positive step forward. The challenge, which isn't really to you, Sandy, but I think is to us as a governing body, particularly with regard to health inequalities, is practically what is it that we're doing and how can we demonstrate that against the actions that we describe here. And I know I think the next paper is going to look at our challenging financial situation. But I think that's the challenge for us is how we can return to this, and I think we'll need to as a governing body, over the next year, and asking ourselves the question, okay, well, where can we identify the actions that we're taking to make an impact on inequalities? But thank you for the work.
Thank you, Mark. Do we have any other comments or reflections? Trish Edney, please.
Thank you. Obviously, I've only briefly read this because I was only brought into this about 36 hours ago. But you do talk about addressing inequalities, and you do talk about unhealthy lifestyles and poverty, but I just think you may need to, as Mark says, revisit it soon, because unfortunately, we're going to have many more people unemployed soon. And this is going to increase inequalities, particularly in different areas, well, the same areas as usual in Sheffield, and we haven't managed to address the inequalities around Sheffield yet, however hard you try.
Thank you, Trish. Amir Afzal, please.
Button isn't working. Can you hear me? Yeah.
We can, yes.
Yeah. Thank you, Sandy. It really does read very well. I'm not sure whether this is the right forum, but one of the things that strikes me is the closer working with other health and social care organisations. And it's an issue that I picked up this morning, and I don't know how widespread this is, but it seems to imply that it was. So basically, a lady whose very elderly mother is being cared for 4 times a day by carers. The carers themselves are obviously having issues with workforce, etc. And rather than be called at 10, 12 o'clock at night, this lady very sensibly decided to move her mother in with herself, very appropriately, so that she could look after her. The issue was that she then turned around and she then said to the relevant bodies that, look, I'll just keep her for the whole 4 weeks. And that way we both know where we are. To which she was told, well, if you do that, then the whole of your package gets cancelled. And you'll be back to square one trying to rearrange things again. I just wonder whether, and furthermore, this lady said to me that she's heard this on more than one occasion from other people as well. Given the current circumstances, I thought it would be a sensible thing to do if somebody could look at this and make the exception till the 2nd of December.
Okay, thank you, Amir. I'm not sure that we're going to be able to provide you with a definitive answer.
No, it was just an issue that I wanted to raise, given that we're working closer with other people.
Yeah.
And as Mark said, it's great having these reports, but they've got to deliver.
Yeah, agreed. I am looking at 2 people in particular on my screen, so I hope you don't mind me putting you both on the spot here. But I wonder whether this would be worth picking up a conversation with John McElwraith and Brian outside of this meeting. This is clearly a really important issue, and I'm sure, Amir, that it's not just going to be that family that's affected by this. But it's absolutely crucial that we kind of look at where we're working together, that actually we are able to provide services as a whole. I've got Mandy's hand popping up here because I know Mandy might have a view here from a carer's perspective, and then we'll take something from Mark.
Just a quickie. I mean, carers have rights as well, and therefore any discussions that happens about this, can you be very mindful of the carers' perspective in this? I'm sure the Carers Centre would be happy to contribute to the debate as well. And I'll check out whether they're getting any information, whether this is happening elsewhere, Amir.
Okay, thank you, Mandy. Mark?
Yeah, this issue about, in particular, voices that when people struggle to be heard, when decisions are being made about their care and health, was discussed a little bit at the Public Engagement, Equality and Experience Committee in October. It is an issue for us, and I think it's something that obviously we do get some stories coming up through Health Watch, which is very helpful. But I think it's one of the areas where unless we hear, as in this case Amir has told that story, we don't hear it consistently, and I think there is an issue for us. I know the Engagement, Equality and Experience team are concerned about this, but it might be worth us taking that back just to look at how we're working systematically. In fairness, I would also say that our experience has been that the big commissioners, like the local authority, have actually been very responsive in terms of trying to make sure that people aren't, have behaved exceptionally in terms of trying to respond to individual needs. But clearly this needs to be picked up.
Okay, thank you for that reflection, Mark. Are there any other comments or reflections or questions for Sandy? Okay, so I'd like to ask governing body whether they will approve the operational plan and the detailed priorities underneath that plan, recognising that there is still work to do within our system across Sheffield, and the need for us to flex and adapt that plan in response to feedback, as we've just heard, but also in response to the ongoing challenges we will face as we move through COVID and hopefully onto a slightly brighter world on the other side. So I'm looking around the screen, I can't see any dissent. I can see lots of thumbs going up. So Sandy, we are approving the operational plan. Thank you.
Thank you, Chair.
So just before we move on, I just want to, Sandy, if you could feed this back to all who have been involved. I know this has come back to governing body on a number of occasions, so that governing body can be fully involved in this. But I do think we need to recognise that this is a substantial piece of work, that our staff have managed to progress this, working across partnerships with other organisations, and that we've done this in the midst of a pandemic whilst responding to that national emergency. So personally, and on behalf of governing body, I would like that to be recognised, and really recognising that this is something very different to what has come before. So if you could pass on those thanks, I would be grateful.
Well, thank you.
Okay, so that now takes us on to our next item. So item 10, and that's paper E in your noting pack. And that's the updated financial plan for 2021. And I'm going to hand over to Jackie Mills, please.
Thank you, Terry. There are just a few things that I think I want to draw out from the report, and then I'll open this up to any questions or comments. So as noted in the paper, the original financial plan was approved by governing body in March, our meeting on the 5th of March. But clearly subsequent to what was agreed in our financial plan, the whole financial environment of the NHS changed in light of COVID. So as I've updated governing body in previous meetings, the funding we expect to receive for the first 6 months of the financial year, so that being April through to September, is expected to be based on actual costs incurred. But as we move into the second part of the financial year, so the period covering October through to March, we've been given a revised financial envelope. Plus, as a system across South Yorkshire and Bassetlaw, there were some additional resources allocated to cover COVID expenditure, a small amount of growth, and some top-up funding for our NHS providers. So we came to an agreement about how that funding would be distributed across the different organisations, and governing body members will recall that I gave an update in private just around the key issues and challenges that the new arrangements gave us for the last 6 months of the year. So as the paper notes, we were required to submit our operational plan for the last 6 months of the financial plan for the last 6 months of the year. We submitted that plan on the 22nd of October, and as previously discussed with governing body, that plan did show a balanced financial position, but recognising that position was based on a significant level of efficiency delivery, plus also highlighted a number of financial risks for which we had no mitigations. So that plan was submitted. I think it's clear that the level of challenge for the remaining financial year will need to be very closely monitored, and that we need to quickly mobilise a series of plans to be able to deliver the financial position. So clearly that will be a significant area of focus for the senior management team and the finance team in particular. So I think they were the key things I wanted to pull out. So the ask is that governing body approve this revised plan, recognising that that's built up in two parts. So the month 1 to 6 built up on actual costs, the month 7 to 12 position being built up on a fixed financial envelope. And also to note that there continue to be a range of significant financial risks that we will need to manage to the end of the financial year. So they were the key points I wanted to draw out, but I'm happy to take any comments or queries.
Thank you, Jackie. So I'll open up to comments and questions, please. So Anthea Morris.
I'm Anthea Morris. I'm the lay member for Audit and Governance. Jackie, thank you for preparing the plan again and explaining it to us again. I've got a couple of questions, please. One, I think you produced this plan before we had the current announcement of lockdown and the announcement of how that might change our operations at the CCG. So I'm guessing, but I don't know, that there's an expectation that things may well change again rapidly at short notice, and another plan may well have to be produced with a different set of assumptions. And then two, what's our commitment to frontline services as we go through this period? How will these changing budgets impact on what we're actually delivering in Sheffield to patients?
Okay. So yes, and I think when I started writing the paper, I did note that things may change due to COVID. Clearly, as that paper kind of came to fruition and where we find ourselves today, the situation has evolved even further. So I suppose what the change in situation gives is more financial pressures. So clearly we need to mobilise our response to be able to deal with the situation as it changes, and that will be our primary focus. That may increase our financial commitments, and so the level of financial risks that we will bear over the coming months. And clearly we will continue to flag that through the South Yorkshire and Bassett Law ICS, but also with the regional teams and nationally. As we move into the national command and control structure, so we'll cover this probably a bit later, but as we move into a command and control, what we experienced in the first wave and the period April to July was lots of information coming out from the centre about what the requirements on CCGs were to respond. And there were specifically things like guidance to how we should support primary care during that. So I think there's probably an expectation we will get more of that guidance as we go through the coming weeks. But even if there isn't national guidance, we need to be prepared to respond to what our local circumstances are, as you describe, in terms of the front line. So one of our immediate priorities at the moment is to look at primary care resilience and the pressure that practices are under, particularly workforce pressures, and we are looking at what we need to put in place to be able to support that.
Thank you, Jackie. Chris Neal, please.
Thank you, Jackie. I can see a great deal of work going into this, and also, as you pointed out, those new situations to respond to. It's similar to what Anthea has just raised, in that, you know, the concern about the modelling hasn't picked up some of our core needs and the need to record that, because there will be an expectation that we haven't managed within this budget. And how can we make sure, I'm sure you're doing work, I know from the report, to actually look at how they've decided this model. But I particularly wanted to note the mental health investment standard and concerns that it underestimates the funding even to be compliant with the mental health investment standard. And I know how much the demand on mental health services and the need for more public health prevention work in communities because of COVID, which is increasing and is likely to grow. So to be in a position where we've got this, you know, underfunding for some of the core work to do with the standard. There is a note further down about some potential other funding for mental health. but I don't know how much that is going to help or that is more minor. So I know there's a few questions in there, but I just wonder if you could clarify the mental health one, the issue and the issues about the model itself, and if we're likely to change that.
Yeah, so clearly we've worked very closely with our partners, CCGs, to identify whether these issues are common. So the first thing to say that they are common across the ICS, South Yorkshire and Battlelaw CCGs. We have worked with the ICS team, so Leslie will probably want to come in a moment just to talk about the lobbying that the ICS have been doing with the regional team on our behalf. I think in terms of how successful that would be, I wouldn't like to say. Clearly, you know, the economic situation of the country is very challenged, and I'm aware that the discussions between the Department of Health and Social Care and Treasury were very challenging. So the idea that suddenly the financial settlement will change at short notice is difficult, but as we noted in the previous question, the situation continues to change dynamically very quickly, so never say never. In terms of the specific question around mental health investment standard, the thing I would say is that we've continued to make the commitments that we need to make in terms of services. So whilst it causes us a financial pressure, we haven't used that as a reason not to continue with those investments that we'd already agreed before COVID even impacted. And we continue to monitor the changing needs as the situation develops. So that's the reassurance, but clearly that builds up to the level of financial risk that I've highlighted in this report. So Leslie, I don't know if you want to come in at this point.
Yeah, I'm happy to, Jackie, and I think it's just to echo a couple of things that you've said, and very importantly the last one, that against this background we continue to prioritise our investments and our commitment to frontline services, and I think that's important to note. I think the other thing that's important for governing body to note as we sign off this plan, and Jackie's articulated that to us, that from months 7 to 12, we're working within an envelope, but actually we don't really have a clear audit trail between what we might have expected for our months 7 to 12 and the allocation that we have. And there are a number of anomalies, and we haven't given up on chasing those down, and we still are as a system. And again, they're outlined in the paper. They range from prescribing to CHC to mental health investment standards, and there's work still going on with those. But Jackie's right to say, in a fixed envelope scenario, are we likely to see change around that? So I think we do need to have to recognise we are signing off a plan at this point in time, where it's difficult to understand the audit trail between our expectations, what we think our likely spend is, and the allocation that we've got. We are still continuing to pursue any anomalies and any new resource that might come into our system in the next 5 months, be it for COVID or for other reasons that we cited in those. But that still leaves us with a difficult financial challenge that we're committed to try and address, and that's clear in the paper as well. But recognising we find ourselves in a position where we're probably facing more of a challenge than we've done in previous years. And I think just to recognise that against all that I've said, that is not a reflection on our ability to manage our finances. I think it's where we, CCGs and the NHS, find themselves at this point in time. And I don't know whether, Jackie, there's anything I've missed in that you would want me to pick up on.
No, I think that's a good reflection of where we've got to.
Thank you, Leslie. Mandy Forrest, please.
I'm having internet connection problems, so I might lose you. But Jackie, I wanted to ask you on continuing healthcare, because your paper sets out this challenge there, and that's
Mandy, we've lost you there.
And
So we've lost the tail end of the question. So
sorry,
I'm just wondering if you switch your screen off, if you could repeat it so we have audio only. Hopefully we'll get the full message across.
yeah, sorry about this. So in terms of continuing healthcare, if somebody meets the criteria and they're eligible for continuing healthcare, then they must get it. And we've got a huge job in hand, supporting people to have their continuing healthcare assessments from all the assessments that were suspended in the phase 1, I think, phase 2 of the COVID NHS plan. So I am really worried that the national allocation and calculations for us is completely different than the situation we face at the moment and the amount of people who might be supported. So that seems to me a very big risk. And I want some assurances that that won't be a risk faced by the people who are eligible for continuing healthcare.
So I'm absolutely happy to give you that assurance. So the modelling, the financial forecasts we've done have been based on people receiving that care, subject to them being eligible for that. And that will continue. I think it is fair to say that, so clearly one of the things we prioritised during the initial COVID response was home first. So wherever possible, we are trying to get people back into their own homes and put the support in place. What we are aiming to do is also just reassess their ongoing needs for that. So one of the areas of priority is to review those cases and where appropriate to step down those carers as the rehabilitation is successful. So it's not to say that we have to accept everything that we've had in the past. Those forecasts in the financial plan are based on people receiving the care for which they're eligible, but we will continue to test and review value for money as we're responsible for doing as holders of the public purse.
Thank you.
Thank you, Jackie. Any further comments or questions for Jackie? Okay, thank you. So the action required by governing body is 1, to approve the revised budgets that we have set out in the paper, and secondly, to consider the key risks and issues to delivery of the financial plan. So Jackie, are you happy that we have given due consideration to said risks?
Yeah.
Thank you.
Sorry, the only thing I would add is that obviously we continue to keep this under constant review, and I will update governing body on a monthly basis just to give you the updated position on the financial risks we're placed to and the evolving situation as we've discussed.
Okay, thank you. So we've given due consideration to those risks for the financial plan from month 7 up to month 12. And we are now asking governing body to approve the revised financial plan, the revised budget as set out in the appendices in the paper. Okay, so I can see nods and no dissent there. So Jackie, governing body have approved that paper. Thank you. And I'll now move us on to the next part of the agenda, which is papers for consideration. And it's back over to Jackie to give us an update on the finances at month 6 of this financial year.
Okay. I think given what we've just discussed, I wasn't proposing to pull out anything in particular, noting that we expect to receive an allocation that covers the totality of the costs highlighted in this report. The only thing I did want to note is that whilst we expect to receive an allocation that covers costs, the NHS England and Improvement are undertaking a more rigorous audit of costs in month 6 than they've perhaps taken to previous months. I think partly on the basis they've seen a bit of a jump in that last month of the month 1 to 6 arrangements. I don't expect that will impact on any of the figures that we've reported, but I just wanted to highlight that small risk.
Thank you, Jackie. So again, just bearing in mind what Jackie has just updated us on, are there any questions or comments on this paper? So a hand up there from Lee Sorsby. Welcome, Lee, to Governing Body. Good to have you here with us.
Thank you. Apologies for being late. You'll be glad I haven't got the video on. It's Lee Sorsby. I'm a Vice VP of Governing Body. Jackie, just for clarification, on page 6 of the paper, it talked about collaborative working and the fact that Sheffield CCG is a host for the ICS and ACP, and as a result of that there's been a cost incurred of £500,000. I was just not quite clear whether that's shared across all the organisations or whether that's just something that we as a host are responsible for.
Because of the arrangements for month 1 to 6, and that we can receive retrospective top-ups for what we've incurred, it's easier that we take all that cost through Sheffield CCG. As the host, we have claimed that retrospective top-up for that funding. In terms of months 7 to 12 going forward, any financial risk in relation to the ICS or the ACP would be shared amongst partners, not solely by us as the host.
Great, thank you, that's really helpful.
Okay, thank you, Jackie. Any further questions or comments? Okay, so Governing Body has been asked to note the paper. We have duly noted that. We've also noted the expectation of retrospective funding to continue to be received for COVID and non-COVID expenditure above and beyond what we had planned for initially. So I will now move us on to the next paper. So item 12 on your agenda, paper G, Patient Safety, Quality and Experience Report. I'll hand over to our Chief Nurse, Alan Windle.
Thank you very much, Chair. The report that you have in the pack is an overview of the patient safety, quality and experience that the Sheffield CCG team oversee, which we monitor providers and oversee, but also I think it's worth noting that we also provide support to non-commissioned providers as well within relation to quality assurance if it's on the Sheffield patch. So it does go beyond our CCG commissioning responsibilities somewhat. The paper highlights safeguarding. Again, we continue to oversee in a particularly problematic period when we're having these lockdowns, and of course today we're in a situation for a month-long lockdown as an interim, and so therefore sometimes gaining some of those assurances from providers is pretty difficult because they're busy doing the day job, but they're doing a fantastic job in assuring Governing Body and our Quality Assurance Committee on the different aspects of safeguarding. And I think it's worth noting that currently we are seeing a large number of safeguarding adult reviews here in Sheffield, around 15 or 16 currently at the moment, and an increase in domestic violence cases as well, which we're working with providers on, on education support and identifying such cases, so that safety is maintained. We received a previous report through our Quality Assurance Committee and Governing Body highlighting the fantastic work that Safeguarding had done within relation to supporting primary care, which was reduced on the 1st of September. But I just wanted to highlight to Governing Body, a part of that does continue. So our looked after children's nurse, Nikki Shepherd, doing an absolutely brilliant job within relation to supporting continued medical assessments of fostering panels, adults, so that fostering cases can go ahead, because I know that particularly primary care are feeling pushed in this area. And we're also currently planning to work with the local authority, because the regulations have changed within relation to adoption panels, where it has to be a GP that does the medical assessment. They're not currently accepting any assessments from allied health professionals, nurses or such what. So we're currently working through that with the local authority, and we've got planned meetings for that going forward. I do want to take just a minute because the safeguarding team, head of safeguarding, our current designated nurse for looked after children and young people, is leaving the CCG and is retiring. And I want governing body, the exceptional work that Sue Mace has provided in her dedication to ensuring that children and young people are safe, and then supporting as head of safeguarding in the adults agenda. I just, again, I would hope that we all recognise that work, and that's going to leave us a significant gap moving forward, which we're currently planning on a replacement for Sue, but it will be big shoes to fill, I feel. But we will do our best on recruiting sufficiently in order to meet our needs, and I've got no doubt that the full team will support the new designated nurse moving forward. Serious incidents, again, from a serious incident perspective, COVID back in March kind of reduced our ability to gain significant information within relation to completion of reports and ensuring learning from all providers that record serious incidents. And particularly, the team have done a fantastic job in ensuring that where an incident is reported, that we seek initial and good feedback to ensure that that any impact is reduced on the individual, but also there's a reduced incidence of this going forward to ensure that there's immediate learning. From the report on page 4, you will see that the total ongoing serious incidents in the report appear to be quite large numbers. I just wanted to offer governing body assurance that they continue to be monitored between our team and the trusts. It's physically their ability to write the reports in the time frame that the serious incident framework tells us to do, but then being pragmatic because people have been pulled in all directions in order to support frontline services. So there is a line there that number will probably increase, particularly again now over the next month, where we'll be recording incidents, ensuring, on a one-to-one basis, but we won't probably get that final report until a later date, beyond the 60 days that we usually monitor providers with. I think it's worth noting the infection control team, again, as you can imagine, have a massive impact within relation to both winter planning, the COVID situation currently, and are supporting a wide range of providers and services across Sheffield within relation to training, outbreak management. And again, I wanted to just reach out and say what a brilliant job that they are doing between them in supporting the wider system. And I think it's worth noting that the collaborative work that we've heard outside of public governing body within relation to care homes and nursing homes and visiting, the implications of visiting, the wider work that both the local authority and the CCG and partners like St Luke's in wraparound services has been absolutely exceptional in Sheffield, and I think that is worth noting for governing body as well. Continuing healthcare continues to achieve the pathway and direction that we set out prior to recommencement on the 1st of September. We are providing NHS England an improvement with update reports on how well we are progressing in that field. There's some slippage in some areas, and just because of availability of records in this virtual world and getting that assurance to be able to move forward. But that's not impacting on the direct care, and relating back to that question, as assessed individuals are achieving and are receiving the care that they're assessed that they need to be for a quality service. Again, how the next month will affect in a lockdown period, that trajectory will continue to monitor over the next 4 weeks, and obviously come back to governing body to update. Within relation to the COVID period, again, we have to recognise that gaining one cornerstone of assurance to governing body, which is patient experience, again was reduced. So FFT, friends and family tests, was reduced. It wasn't required to be reported. But as you can see in the report, again, Sarah Neal providing significant amount of information around feedback from patients is absolutely exceptional and helps us support us on the wider assurance that we receive both through Quality Assurance Committee and QAC. And finally, the final point I think to point out is the leader process. We've had this a number of times now at governing body, and that is providing the CCG with exceptional learning within relation to previous deaths within the learning disability field, and how we moving forward can change our commissioning and our contracting in order to ensure that the learning disability affected individuals across the city are supported in those health inequalities that we often describe are improved moving forward. And that is, I'm happy to take any questions, Chair.
Thank you, Alan, for that really thorough overview. We've brought this one up the agenda this month because often it's at the end, and I think there are a number of items for discussion and for noting here, Alan, just about you know, the level and the intensity of work that is being undertaken by our quality team. So I will open it up to any questions and comments from governing body, please. Mandy Forrest, please.
Thank you. I think my internet's okay now. Most of these issues we've been looking at in the monthly Quality Assurance Committee. So just to reassure governing body colleagues, we are cited on all of these issues, but two things to particularly bring your attention to: the review, the leader review for people with learning disabilities. We're going to have an in-depth discussion about it at our next meeting in December. See what lessons we can learn from that, and what we can do as commissioners to improve outcomes for people with learning disabilities. And the second issue is, I think, is John, yeah, John, you're still on the video. There is an issue about health assessments for looked after children and delays in referrals being made for children to get their health assessments, and we're not meeting timescales for this. And I believe it's proving difficult to resolve this issue. So I just want to raise that awareness with governing body members. Thank you.
Thank you, Mandy. Chris Neild, please. So Chris, could we ask you to unmute, please?
Got me again. Thank you for this, Alan. It is really thorough and shows how you've increased that flexible approach and use capacity. And I know what Mandy was saying about the extra meetings of the committee. I particularly wanted to ask about the care homes work, and I know that there was training provided in terms of COVID, and I know that there has been some extra work going on about visits to care homes, and that's such a, you know, high on the agenda nationally and locally at the moment. So I just wondered if you could say a bit more about that and where it has been and what's happening at the moment.
I can do, Chris. I probably could take up the rest of the governing body meeting in relation to what activity is, and again, John will be cited on this. An exceptional amount of work, which is the key bit, and I suppose the key element is visiting. So visiting care homes for both family members and their well-being and mental health, as well as the cared for individual in care homes. An immense amount of work has got. Jenny Milner is, you know, absolutely fantastic, working with infection control and our care home quality team, and that's just in our well, and again Jenny over working at supporting in the local authority. John will be able to give a massive amount of list of names, how we've worked with the provider harm within the managers forum to try and work through some of the risk assessments that we've developed, and checklists on infection control. Our infection control team developing checklists so that homes can go through an approach to make it easier for them. And on the whole, we're at the point where with changing guidance, so just as we are publishing guidance to support care homes, we go into a lockdown within that 5 days after we've done probably 3 months of work. Doesn't quite help us, but actually it marries what we're saying. So wraparound services with St Luke's for end of life care, you know, voluntary sector supporting us. I think what might be worth, Chris, is if I work with our internal teams and probably some teams over at the local authority, we might want just a bespoke kind of overview at the next governing body, just to
that would be really helpful.
that work.
Yeah, that would be really helpful to follow that up, and because it's changing, as you say, with the new guidance at the moment, so it's useful to look at it at another point in time as well. Thanks.
Okay, thank you. Lee Sorsby, please.
Thank you. Yes, just to re-emphasise that work really. I know it was an issue that was raised by, there's a group of GPs who are particularly interested in care home services, particularly from a primary care point of view, and they'd raised this issue, and it was really helpful to be able to put the GPs, the clinicians, in touch with Jenny and people at the local authority, and it's just been a really, really good piece of collaborative work, excuse me, which has been really innovative and welcome. As I say, it's frustrating that we've now got a lockdown, but actually I think it's provided a really good foundation for ongoing work. And also to re-emphasise what Alan said about the work that Sarah Neal's doing in terms of gathering patient experience. I've been talking to her, and we're looking at how we can further develop that in terms of getting patient feedback around primary care services. Because again, the feeling is when you're in a, I hesitate to call it a crisis, but a pandemic, you have to quickly change to new ways of working in order to keep people safe, but in order to manage the service and still carry on providing good quality care. And we don't want to lose learning from that in terms of what works really well for people, but also what doesn't work well, so that, because it, you know, it was fine for the first 3 months of the first wave, but now we're looking at a much longer, protracted, different way of working. We really want to be developing that and involving patients in shaping what that looks like, and gaining information and feedback from them. So Sarah's doing a really good bit of work at the moment, looking at how we can signpost people to an online questionnaire, which would be helpful. And the other thing that's come out of this as well is looking how the service works for people who have hearing difficulties, because obviously if everything is telephone as a first point of contact, that's quite difficult if you struggle to use the telephone. And actually we don't seem to have a citywide approach to that. We've got a contract with the BSL interpreters, which is great, but it's how you get that initial access in is usually through a telephone call. So Sarah and I are going to be looking at that and working with people in the deaf community, again, to shape what that might look like and what would work well for them, because that's a certain part of society that seems to have been overlooked. And you hear it not just in health, but in a lot of sectors as well, that it's quite difficult for people with hearing challenges. So just to feedback to governing body that that's going on.
Thank you, Lee. Trish Edney, please.
Thank you. It's really on the back of the leader report and the physical checks for the SMI and LD patients that they're supposed to have every year. Obviously, with the situation of virtual consultations, it's going to be difficult for this to happen. And I know that a questionnaire is being produced, which caused considerable concern amongst the LD Partnership Board the other day. It is an extremely long questionnaire, and it isn't clear for everybody of what it's all about. And I just wonder if the governing body GPs have had sight of this or are working on it, because it's obviously going to be needed to be used with great care and forethought and warning, because it's otherwise you're going to have no result or else confusion and upset.
Thank you, Trish. Sandy, I'm looking at you as our Director of Commissioning Development. Do you have any further insight or information on that questionnaire?
I don't, unfortunately, so I'm happy to take that outside the meeting. I know this has been something that we want to make sure happens as effective and efficient as we can with them. And obviously this is also part of the phase 3 requirements prior to the current situation that we find ourselves in. So it is part of our plans. I'm not aware of the questionnaire, but I'll certainly pick this up outside the meeting.
Thank you, Sandy. Lee, do you want to come back on that?
Yes, I have a feeling that questionnaire has been seen in CLG. I'm really sorry. I feel like I should be a little bit smarter about actually what happened and what was said. But I know we've been discussing it. So, but it was a few weeks ago. So Sandy, I'll perhaps contact you outside this meeting, and Trish, happy to discuss it with you as well, to take that forward.
Okay, that would be really helpful. Again, kind of understanding and appreciating the role Health Watch has in helping shape the information that we need to adapt and develop services moving forwards. Okay, any further questions or comments for Alan, please? John McElwraith.
Thank you, Chair. Just try and pick up a couple of the observations from other colleagues and sort of echo Alan's point that there has been extensive work undertaken across the care home support, across the CCG and council colleagues, and there are regular discussions between CCG colleagues, council colleagues and care homes. We, in commissioning, have regular conversations with care home providers and join some of that intelligence up. There's been the deployment of additional staff to support care homes when they have to have staff who isolate. We've talked about, and I rightly talked about, the infection control arrangements and the work of Jenny Milner, but I think it's to amplify the point about the integrated, joined up approach to that support across our colleagues, and happy to contribute to a broader discussion at some point if that's required. And just to pick up the observation around the children in care, looked after children and health checks, that was picked up at the Children's Improvement Board. And apologies for me, I can't recall the colleague from the CCG's name who represented you at that meeting, but she and Children's Services colleagues were taking that away as an action to look into, to report back to the next Children's Improvement Board, which is later this month.
Okay, thank you, John. So I'd like to wrap up this item now, unless anybody has anything very significant they'd like to add. Brian?
It's significant in the fact that a lot of our staff today heard from Jenny in terms of the work around the care home. So I think there is something we really need to capture and take back into governing body around some of that work. So I'd like us to commit to bring that in next month. So that was the only thing I wanted to say, Terry.
Thank you, Brian. Okay, so governing body was asked to consider and note the report. I think we've given quite robust consideration today, and clearly we have noted the information in that report. Governing body wishes to wish Sue Mace a very happy retirement. If you could pass that on our behalf, Alan, and thank Sue for all of the work that she's done with Sheffield CCG right back to when it first started. Second thing that I'd like to note is really just to say thank you to the quality team for stepping up our usual quarterly quality meetings onto a monthly basis, so that we could really keep a very close eye on what was happening across our healthcare and social care system throughout the pandemic. And a big thank also to our governing body GPs, who wouldn't usually be part of that committee, but have availed themselves to really give us a clinical steer and a clinical view on those particular quality issues. Okay, item number 13, paper H in the papers. That's month 6 performance and delivery report. Over to Kath, please.
Okay, thank you, Chair. So this report covers a few different areas linked to performance assurance. There's the key performance measures linked to the providers, but recognising that's in the context of the COVID pandemic. And then there's performance linked to staff, and also the experiences of our staff and the views and experience of our staff. And then there's a section at the end around COVID and around the local situation. So it's quite a mixed bag. I was going to pull out 2 key points from it. One being about the COVID impacts on our elective services, and then the other one linked to the learning from COVID and the impact on the staff, and also how this links to embedding what's worked well during the first round of command and control, and how we've kind of moved that into the organisation. So those were the 2 key things I was going to pick up on. So COVID impact on elective services has been talked about in previous meetings. So, you know, we've seen a growing number of 52-week waits, which isn't surprising given what we're going through. And those are predominantly due to inpatient treatment. And it's the impact of COVID is clearly what's caused it. Sheffield previously just didn't have 52-week waits. And in August, there were 178 for Sheffield patients that were in this category. Elective services have restarted, and that's been in place for a number of months, but there's a lot of pressures on the service, as I'm sure you're all aware. And the Trust have a number of processes in place to make sure that that clinical risk is being managed and mitigating as far as possible the risk. There's a bit more information that we've got in the report following feedback from previous sessions. So within the report, we can see the 52-week wait figures from local and similar providers. It shows that actually Sheffield looks a lot better than the other areas. Still, we don't want any 52-week waits, but if you compare how we look to other areas, it is significantly different. I saw some of the London ones and they were horrendous. So I think, you know, that gives a level of assurance and puts it into context. At the previous session, Dr. Amir Afzal asked about whether we could break down some more information around the 52-week waits, particularly in Children's Hospital, which are a bit higher than the SGH figures. So we've done that, and we can see that plastic surgery and orthopaedics are the higher areas for the longer waits. The report also includes a lot of information in the more towards the end of the report around how the waiting list is being managed and being validated as well, and that's from both providers. So that's that bit. Learning from the COVID impact on staff and how we've embedded the learning. So we've talked a few times around the staff temperature check, which we've had for a number of months now, which is a regular quick survey that staff complete, which is now done on a monthly basis recently. And we're really grateful to the staff that complete it. We're trying to get the numbers up, but it's that information is being used, and it's being used at lots of different levels within the organisation. And it's informing the work that we're doing, the communication that we have with staff, and it's brought into the briefings that we have with staff. We've discussed lots of different things, and it does, these areas that we discussed do flow through into this report. This morning, Leslie and I talked about leadership at the Zoom briefing, which was great. We've got future sessions planned on performance development reviews and having good quality reviews, about good practice in virtual meetings. That's a big thing that's coming out of the temperature check. People struggling with virtual meetings, so we want to do everything we can to make that work well. Alongside this and linked to it, we've had the COVID learning group that has been doing some really, really good stuff, collecting staff stories and recommending to the organisation. So that in the later session, in the private session, there's a really good presentation to come around that. So that's something to look forward to. And finally, just to pick up on the learning that we've built in around command and control. So today we're going back into it, and it feels different from before. And I think that's because we've embedded what we've learned, and actually going into command and control doesn't feel the same as it did last time. It's embedded in our process, our ways of working, and it's just stepping up from where we are now rather than the shock that we had before. So I think that's a really important message as well. So happy to take any questions.
Okay, thank you, Kath. Before we get on to the questions and comments, in the interest of time, bearing in mind that we're going to go into quite a bit of depth around the COVID learning group, if we could keep the questions in this meeting kind of minimal and relevant to public meeting, so that we can discuss that in greater detail later on, that would be very helpful. First question, Mark Gamsu, please.
Right, okay, a very simple question. The last graph, it says, based on registered deaths, Sheffield is recording an average of no deaths a day based on the previous 7 days. Is that right? I didn't, or could you explain what that means? Because I didn't understand it.
When you start things with, that's a very simple question.
Oh, no.
I don't know the detail of that, so I can find that out. And
if it's not correct, we need to.
Yeah, I'd have to find out because I didn't pull that graph together myself. So I can feed that back. Is that graph right at the end?
Yeah.
Yeah. Okay.
Okay, thank you, Mark, for that observation. Jackie, did you want to come back on that?
Yeah, sorry, just to note that data is as at the 8th of October. And so obviously the situation has moved on quite a lot since then. So Kath, the data we're monitoring, we can probably share that with governing body members latest.
Thank you, Jackie. Lisa Phillip, please.
So just unmuting myself. I'm Lisa Phillip, one of the Elective GP members. Thank you so much for presenting that, Kath. There's so much good information in there and so much good news, like the 2-week wait times, we're still maintaining those in this crisis. So I think that's remarkable. I think the only thing that I was looking at was the 1 month wait when the second treatment is surgery. So people are waiting a lot longer for their surgery. I think we go down to 67% when we look at the monthly numbers. I know that they have the patient tracking list to have a look at safety and things like that, but the emotional toll on the patients must be quite significant. I guess my question is, are there any sort of mitigations in place or planned to try and improve that? Like the varicose vein surgery is outsourced. Are there any plans to do anything like that? Do you know?
I don't know, but I can hand over to Sandy. Would you be able to answer that question?
Or perhaps Leslie.
Oh, Leslie.
It might be Sandy. I'll come in first. I think when I was thinking for the last item on our agenda, how we've gone through with COVID, an approach of respond to a pandemic, then an approach of restore, which is bring back some of the critical services, and then an approach of recovery, and then the final approach is reset. But it looks like we've gone back to the respond stage as of today. But in the recovery, which is picking up on those patients who have missed out on their care and their journeys have been lengthened because of increasing waits due to COVID. There is quite a systematic approach being taken across South Yorkshire and Bassetlaw, which is looking at our waiting lists in terms of top priorities, P1, P2, P3, P4, moving ahead in relation to clinical prioritisation of treatments, ensuring that across each of our 5 places, we're tackling the P1s and P2s in priority order as we try to recover the position, and that we're making use of all of the capacity available to us. And if you remember, at the beginning of the pandemic, we had some national contracts in place for all of the independent sector activities, also making sure that we are making use of that activity against that approach of clinical prioritisation. And Sandy, I don't know whether you've got any more detail to add to that would be helpful.
I couldn't say it better myself, Leslie, but one thing I would say is that we are working very closely with our provider colleagues and looking at the urgency and the clinical urgent cases in regards to this to make sure that there is a system-wide response if needed, if some of the providers are struggling to deal or meet with some of the elective activity that are clinically urgent. So it is something that's being monitored and managed across South Yorkshire and Bassett Law.
Thank you. Thank you.
Lee Salisbury, please.
Just to add to that, we were looking at an aspect of this in CLG in terms of how to expedite appointments where the clinical urgency has changed. So that is being monitored. I suppose my only observation in it is this is a real aspect where we could make a difference to health inequalities, either for good or for bad. And we just need to be clear when we're looking at prioritisation that it is based on clinical need rather than demand. Does that make sense? So we don't want it to be just the people who shout the loudest who get moved up the queue. It's got to be clearly based on clinical need and making sure that we're assessing that across the board throughout the whole population.
Thanks, Lee. And Marion Sloan.
Thank you. I'm part of a working group where Primary Care Sheffield is working with STH managers and the consultants at the hospital in gastroenterology and respiratory medicine. And what that group is charged with is looking at the waiting lists. So looking at the referral letters from GPs and trying to find out if there's any way of sifting through that group of people who haven't yet been seen to find out the ones who may be more at risk, to try and maintain some consistent quality and safety for those patients that are still waiting for that first response from the hospital.
Thank you, Marion. That's very helpful to hear. I'm going to take a final comment from Zach McMurray, please.
Yeah, it was just to reiterate, Terry, that we've got a lot of clinical input working with the hospitals to try and prioritise. So the CDs, myself, are involved in discussions with them as well. So I think, you know, it is an issue because there's a wait, but I think we're doing everything we possibly can to try and alleviate that.
Thank you, Zach. Okay. So I think we've given some robust consideration to the report, Kath. Again, if you'll pass our thanks on to the authors of that report, particularly in its responsiveness to the asks from governing body last time, to bring the information back in a way that was perhaps more useful and more meaningful for us. That's been very, very helpful to see those changes. I will now move us on to item 14. So this one is titled Progress on Inequality, and I'll hand over to Brian Hughes and also to welcome Helen Mulholland and Richard Kennedy, who will be presenting this item with Brian. So welcome Richard and Helen from the engagement team.
Thank you, Chair. And Helen and Richard are listening, but I've got them here because they need to take credit for pulling the detail together, and also it just reflects the progress but no complacency in terms of where we are. So thank you, Helen and Richard, for what you've done. And there's an element of me that's really pleased with where we've got to already. I put this on the agenda as a specific item which was around, and it responds to what Mark said earlier about our responsibility for inequalities and tackling inequalities. But already throughout everything that we've talked about today, from the operational plan in terms of focus and where our intentions and priorities are, and I was pleased to see the response to that also slightly annoyed and upset, Trish, that it's that bit of, so what have we done and where's the progress on it? So what I wanted it on the agenda so we don't forget and we don't lose sight of it. That's why it was there as an item. I asked Richard and Helen to sort of pull together, but what are we doing about it? So we don't lose sight of that as a governing body. And they have pulled together a couple of slides that I'm just going to share with you. So hopefully, if the technology allows, can people see? No, that's not my screen, is it?
It is your screen that I can see there, Brian, a PowerPoint presentation.
Perfect, thank you. So what I want to do just for a moment is to bring it down and focus on racial inequalities. But as soon as I say that, that's not the only area that we are focusing on. But I wanted to bring in some issues and some examples of what we are doing and have done and will continue to do and need to do, but with a focus on racial inequalities, particularly with Black History Month that we've just concluded a few days ago, and the Black Lives Matter sort of work that was done and started and campaign over the summer. So it was trying to look at that with a focus, but making sure that we channel that wider into but what is our approach and what are we going to do as an organisation around inequalities, tackling inequalities. So we will remember at our development session last month, there was an acknowledgement and a commitment to do more around inequalities and to make it happen. And that wasn't just us, that was our partners across the city. And again, Marion, here and what you're saying around some of the work that we're doing with our partners in terms of identifying those most at need is a commitment to that. An acknowledgement as well, as John McElraith said a while ago, about working alongside our communities as equal partners and engaging with that. And I think we said last month, and that's why I'll keep coming back to it, understanding that our equality legal duties can only be discharged at governing body. So it is our responsibility to continue to drive and take that work forward. As we've already said, throughout the course of living with and through COVID, we know and acknowledge the disproportionate impact that COVID has had on our groups and our sort of disadvantaged groups. And there is an opportunity and momentum to make positive strides to address health inequalities felt by those communities. And Helen is deeply involved in those groups with it. We do know with what has happened and where we are today that that work needs to be accelerated because that impact is going to be felt even harder and deeper in what we will experience. In terms of the gap analysis and those strategic gaps, two big areas that we've started to look at are the AME action plan and the number of themes that are detailed there around access to data, talent leadership and harnessing that leadership, looking across our staff groups, what we do as a commission and organisation with our local authority colleagues as well in that, and how we get our comms and engagement right in that, are those themes in that plan. And also want to pick out the Tackling Racism in the Leadership Pipeline, which was a conference held in early October with 70 delegates across the city in a virtual space, and the themes that are emerging around that and how we capture those and bring those forward. So that's how we start to frame it. What have we done within our organisation and capturing some of that around when Black Lives Matter came to the forefront, the statement of intent that we put out as a clinical commissioning group to that, the work that we've done within our organisation around our equality structures and our equality groups within the organisation, the quality and equality impact assessment policy that has been agreed and is now at the front of every governing body paper that we take through. Black History Month, which I've already acknowledged, the Race Equality Commission, which is now live across the city, which Mark and myself will be in attendance in early December, and also some practical things around our flu vaccination campaign. And we know the harder to reach communities, and can we work with our community groups to encourage those messages and trying to increase the uptake with our communities. And already working with 11 of those partners to increase that uptake. Across our partners in the system, it's looking at how we work in the ACP in framing our commitment to our communities, the Equality Leads Network across Yorkshire and the Humber and across the ICS, and a number of other areas which I've already outlined within it. So I just wanted to sort of draw that to a conclusion of, so there's lots that's happening, both that we're doing as a CCG, that we're doing with our partners, but there are 3 questions that still remain for us to take forward. And if I could see my colleagues on the screen, I'd go to my partners who've committed last month to work with me in terms of Lee, Lisa, Chris and Marion, in terms of what is our strategic vision for reducing inequalities for communities from minority ethnic backgrounds? What impact do we need to have for the real people, including our staff? And what are our short, medium and long-term strategic aims and objectives on this agenda? Dr. Muna Abdi, who led the work on the tackling racism in the leadership pipeline in Sheffield, has agreed to be our external facilitator for that work. So what I want to do today is take the enthusiasm and the encouragement and a bit of a progress statement into that, to then take that into that group and then take those questions forward into how we act and take that forward as a governing body. And what I just want to leave governing body with is a statement that came out from our communities group, which met this morning, which Helen was in, and John McElraith, who's also on the call, was in as well, which gives me a chink of hope in terms of there is a deficit of trust and relationships. We are making some progress, but we have still got a journey to go on. And that's what we need to sort of acknowledge. That's what we need to accept. And that's what we need to sort of move forward on. And that was hot off the press at 11:45 this morning, when we've got some of our community groups starting to acknowledge we're starting to make some progress, but we've still got a long way to go. I'll pause at that point and try and somehow stop sharing my screen. And I'll ask Helen and Richard, have I misrepresented, missed, or is there anything else you would like to mention or pick up on that?
Thank you. I think it is just about the acknowledgement that the journey that we are on, and certainly talking to the BAME Communities group this morning, certainly there's progress being made. We were thanked specifically for the work that we're doing around flu and the funding that we're putting into the city in relation to that. But there is still a long way to go. And this is an agenda that we obviously need to make huge strides forward on. But I think there is great will, certainly within staff, in a decentralised model, which is really exciting. Lots of staff are really keen to get involved in this agenda, and there's some brilliant work going on. So really, I think it's to thank the goodwill and the passion of many people within our workforce in terms of moving this forward.
Thank you, Helen.
Thanks, Helen.
So any reflections, questions or comments for Brian, Helen and Richard? So John McElraith, please.
Yeah, thanks for the presentation, Brian. I didn't realise there was going to be a connection to this morning's meeting, but you captured it perfectly in terms of the progress being made, and your second bullet point on the next steps, your penultimate slide around the what impact are we going to have, was the other key message from this morning. So it's great that we're starting to pull things together, starting to reflect on what we need to do to achieve our aspirations, but we need to get on with what I heard loud and clear was we need to get on with making that difference. The so what question needs to be addressed a little bit more quickly than it currently is. But I think it was a strong conversation this morning in terms of, as a collective, they're wanting conversations with ourselves as the council, with the CCG, with the ACP. We've got that opportunity and we've got that chance now.
Thank you, John, and never let it be said that discussions in governing body are not hot off of the press. So Mark Gamsu, please.
Yeah, thanks. I mean, just to affirm, that was a really helpful presentation, Brian. We had a discussion about the CCG's submission to the Race Equality Commission that's been convened by the council, and we'll be getting feedback on that. And as Brian said, we're involved in it directly. I'm not sure that the submission has been shared with governing body yet. I know it's come to speak, but I think it would be helpful if we shared that with governing body. I mean, just a couple of, there are a range of comments, and I'm generally welcoming the submission. I think one of the comments which I think is sort of acknowledged, particularly on the leadership and capability side of the CCG, is that one of the things it's important to look at is, have we got adequate resources in the CCG to ensure that the inequalities / equalities agenda is maintained. So I think that's one of the things that we want to keep an eye on going forward. And the other bit, which we'll see, is that rightly so, we've presented a clinical commissioning group view of what our perception of equalities and inequalities is in our submission. But the discussion recognised that there's obviously, that's in a wider context where a lot of the inequalities are actually caused by the social determinants of health, or affected by the social determinants of health. And as we move forward, we need to, as a city, produce a more co-produced, shared view of inequalities.
Thank you very much, Mark, for that reflection. I will continue with the questions and comments, but just noting that Brian has around 90 seconds to spare before he needs to be in another very important meeting. So, Brian, I think we'll bid farewell to you, and thank you for bringing that. And if there are any further questions and comments, I'm sure Helen and Richard would be happy to pick up those reflections and feed those back to you.
Thanks. And we'll share the slides as well, so governing body have access to them as well. So thank you. See you all soon.
Thank you, Brian. Okay, are there any further reflections, questions or comments at all?
I was just going to ask for them, the slides to be shared.
Thank you. Yes, so I think we've got a commitment, and we'll make sure that those are shared with you over at HealthWatch, Trish. Okay, so I'll move us on then to the next item. Thank you, Helen and Richard, for joining us. You're welcome to stay for the remainder of the meeting, although I'm sure you have other things that you need to get on with. Thank you. So now over to Leslie. So we've got 2 items here. One of them is the oral update, accountable officers report. And the second part is the integrated care system and ACP partnership oral update. Leslie, do you wish to take those as a single item, or do you want to separate them?
I was going to take them together. And
okay.
I think probably most of what I've got to say we've picked up in conversation during the meeting. I think it's just worth noting we move in such a rapidly changing world that actually submitting some written papers, they become outdated by the time we get to the meeting. So I think really 2 things to note in relation to our work with our partners across South Yorkshire and Bassetlaw and in Sheffield. That as an NHS system, we've gone back into level 4 incident. So we're under national command and control again. And that will begin to unfold, I think, over the next few days and weeks. But equally sitting behind that, had we not been there in that sort of rhythm of going from respond to restore to recover to reset, I think all of our partnerships were turning their minds to think about the future and to think about how governance in partnerships, be they across South Yorkshire and Bassetlaw or be they in place, how that works in the future and what's our vision for that future reset world.
Thank
and I
you.
think that's just the key things for us to note and be cited on.
Okay, thank you, Leslie. Any questions or comments for Leslie on that update? No. Okay. So I'll move us on to part 4 of the meeting, which is a consideration of reports circulated in advance for noting. Does anybody have any issues they wish to bring up with any of those papers? Lee Salisbury, please.
Sorry, it's me again. One is just a sort of typo, I think, and the other is a question. So on paper 17D, which is a report from the PCCC, the Primary Care Committee, point 2.4, it says the committee acknowledged that some patients are not delivering the service they deserve because of health inequalities. And I thought that was a little harsh. So that obviously should be receiving, but the point is important, I think, and it underlines where I think I came in at the meeting, where we were talking about urgent action is required to address the identified priorities within health inequalities. So I suppose it's underlying that, but if we could just change that. And related to that is from paper 17C, the report from the AIG, not wanting to put Lisa and Anthea on the spot, but there was a comment at point 2.3 where it said the internal auditors gave only limited assurance to the report on health inequalities due to one high risk recommendation. And I just wonder if it's possible to, oh, and Chris as well, you're on AIG, aren't you? Just if it's possible to have a bit more information on that.
Thank you, Lee. I'm going to pass over to Anthea as Chair of Audit and Integrated Committee to discuss that for us.
Hi, Lee. So yes, we had a limited assurance report on inequalities, and the high risk recommendation was not about having smart and measurable objectives in relation to our inequalities work so that we could track our own progress. And I think we were disappointed but accepting of that recommendation. I think we have had some lessons learned from the report as a whole, which I'm happy to discuss with you outside the meeting. And I think a lot of it though is it was our first remote or distance, however you want to call it, audit, and I think we need to improve the way that we work with internal audit in that team. But I think fundamentally the point was it was about smart objectives in our inequalities work so that we can track our progress.
I just,
thank you.
Sorry, if I can just come back on that. I just wonder whether there's some work to be done, you know, as Brian set up the health inequalities task group, whether perhaps we ought to talk about that, because we shouldn't be working separately, should we? We should be working together and not duplicating it, because it will affect both groups, won't it?
I hope they are, but I think that's another good point about how I'm not sure how those levers will go, and Jackie or Sue might be better off asking Bill or Kath.
Okay.
Better off asking how those transactions work, but I would hope that they would be.
Thank you, Anthea. So I think, Lee, you've inadvertently volunteered yourself for a conversation with Anthea outside, but we will do that under the auspices of the Inequalities Working Group, if that's okay.
Always a pleasure to talk to Anthea. That's absolutely fine.
Fantastically, thank you. Are there any other comments or queries around the papers that have been circulated for noting? Jackie, please.
Sorry, not to labour the point, but just in terms of that audit, so Brian is cited on the report clearly, and the lessons learnt, particularly around how we framed the audit, because part of the terms of reference probably weren't as helpful as they ought to have been in terms of that. So the work that Brian's doing is really, in some ways it's helpful to get to receive an audit report like that, because it points you in the direction of clear actions to take.
Thank you, Jackie. Okay. So next is any items of any other business. Nothing has been declared to me in advance. Does anybody else have any items that they wish to declare or bring up at this point? No, I have one item, and I can see Mandy Forrest about to cringe at this one, but I'd just like to highlight that this is Mandy's last public governing body as our lay member, and I just wanted really to pass on our thanks, really, Mandy, for the core role that you've played in our CCG as a lay member since it was established back in 2013, really playing that role as a critical friend to us commissioners here. And really throughout your time, I think it's fair to say that you've been relentless and passionate about bringing the public view and the public voice into everything we do, everything we discuss and the decisions we make as a governing body. Added to that, you have always been a staunch advocate of the VCSE sectors, and in particular highlighting that role of carers. And you know, that's often underrated, but you always keep our mind focused on the important roles that carers have to play in supporting many vulnerable people across the city. In your role as chair of our Quality Assurance Committee, you've helped us keep a really close eye on the quality of our services, but not just from the viewpoint of whether we're achieving targets, but really a sharp focus on the experience of patients, their families and carers. And I would say beyond the functional parts of your role as a lay member, you've been a friend, you've been a mentor, and you've been really wise counsel to so many of us on governing body. And also alongside that, never afraid to provide constructive challenge. My personal reflection, I started as chair a little over a year ago, and you've been there by my side, supporting as a listening ear, giving kind advice, as well as formative feedback and constructive challenge where it's due and where it's needed, through what's really been an absolutely bizarre and really challenging year for all of us here. So none of us can really be sure what the future holds at this stage, with the national restrictions that we're facing, and you know, the world looks very, very different to the world that we had back in 2013 when you joined us in Sheffield CCG. But I want to take this opportunity really to wish you a very happy retirement, and to thank you on behalf of everything you've done for Sheffield CCG and for the people of Sheffield. Through the work that you've done, although you won't be here with us in the future, the legacy of, you know, how you've supported our staff and how you've helped the organisation advance will live on through the work that we continue to do into the future. So this point, we'd normally give you some flowers. I'm not quite sure how we're going to do that virtually, Mandy, but thank you. And if you would like the last word, the microphone is over to you now.
Blimey, thank you. I wasn't expecting that at all, because you still got me for another 8 weeks, although this is my last business meeting. I can't imagine life without you all, actually, at this point in time. I've really enjoyed being a lay member at the CCG, and I hope I have been of help and of use. And I just really wish you all the best. It's such a difficult time. And I just know everybody who's on the governing body and all my colleagues, all the staff, are here because they want to do something really positive and good. So I wish all of you the very best, and I'll say goodbye properly, hopefully in December. I hope we're going to have a virtual drink as a governing body sometime in December. So thank you. That's really nice of you.
Thank you, Mandy. Okay, so I can see the applause there. We'll do that for real.
Thank you.
Thank you, Mandy. So that leads me now to close the meeting. Usually at this point, we would ask for some reflections from governing body. I think we'll have one reflection, and that's the key role Mandy's played for us over the past 7 years. So I'll bring the meeting to a close now. Our next public meeting will be on Thursday, the 14th of January, 2021. So it feels rather early, but wishing everybody viewing us from the public gallery a very happy Christmas and a happy New Year, and we will see you in January.